Hello, my name is Liz Tyser, Public Health Emergency Coordinator for Johnson County, Kansas. This Dispense Assist training is brought to you by the Johnson County Department of Health and Environment with funding provided by the Centers for Disease Control Cooperative Agreement. All information provided in this training is for educational purposes only and should not be relied upon solely for emergency planning purposes. Processes, products, and trademarks shown are only for examples and do not reflect a specific endorsement of any product. Dispense Assist was created and is maintained by the government of Johnson County, Kansas. There are a variety of prerequisite trainings recommended before completing this training video. These prerequisites may help you better understand the statements, processes, and basic principles referenced but not discussed during this video. ICS 100 and 200 and NIMS 700. The following topics are covered in this training. Dispense Assist process, how to provide pills, pills versus influenza vaccination, summary and local information. The Dispense Assist process is very simple. In the event of a bioterrorism incident or pandemic influenza, the local jurisdiction needs to dispense antibiotics, in the case of anthrax, or vaccine in the case of pandemic flu. If there is a case of limited exposure to aerosolized anthrax, like an office building, a specific message to the people exposed in the office building will direct them to complete their voucher online. In the event of a community-wide exposure to anthrax, the message will direct the whole community to complete their voucher. The local jurisdiction sends out the message that medication is needed. The dispensing locations are set up, staffed, and opened. People arrive with their completed vouchers. Different jurisdictions will have different processes, but in general, if they have their voucher, they are immediately directed to the dispensing line. If they do not have their voucher, they're instructed to complete one on site. That location may be off-site like a library or a school computer room, or it may be a kiosk right there at the dispensing site. Each jurisdiction chooses which process they want to use. Be sure to ask your supervisor what process your jurisdiction will be using. Individuals who are directed to the dispensing line will have a printed voucher containing the demographic and health screening information. At the top, a letter or a group of letters in the upper left-hand corner indicating which medication the individual can receive. A C indicates they have been medically screened and can receive ciprofloxacin, or Cipro for short. A D indicates they have been medically screened and can receive doxycycline, or Doxy for short. A C/D indicates they have been medically screened and can receive either Cipro or Doxy. If the individual can receive either, the jurisdiction's protocol must indicate which medication is to be dispensed. This could be as simple as stating, in the event of a C/D voucher, Doxy is the primary medication. Persons with an X should be directed to either a supplemental screening station on site, to their own physician, or to a physician partnered with the jurisdiction for further evaluation and medication provision. Each jurisdiction will have their own protocols for handling these individuals. Ask your supervisor how to handle that situation. The label is removed from the pill bottle and placed on the voucher. Each bottle is labeled with the correct name and date of birth. The individual is provided the FDA-required emergency use authorization, as well as any other required handouts, and reminded to take all the pills as directed and to follow up with their physician. The voucher is kept, and the person is instructed where to exit. The entire dispensing process for one voucher should take less than 45 seconds. If the individual has multiple vouchers to process, each additional voucher should take less than 30 seconds to process. The process related to providing influenza vaccine using DA is only slightly different than when using DA for pill dispensing. The voucher information is exactly the same with regards to demographic information, screening question responses, and where to document the lot number and what was provided to whom. The difference is in screening. DA will screen for one medication or the other for pill dispensing. For influenza, DA only determines if the person is medically eligible to be vaccinated. Dispense Assist does not make a determination of what vaccine to provide. The responses to the screening questions help the vaccinator determine the appropriate vaccine to administer based on the jurisdiction's, agency's, or hospital's protocol. Only the first 3 questions determine if the person can or cannot receive vaccine. The rest of the questions determine which vaccine to provide. They are directed to the vaccination station with their voucher. If no voucher is provided, then that individual is not a suitable influenza vaccine candidate. Simply put, when dealing with pill dispensing, the following basic information applies. 1. Something has happened. 2. A decision is made to dispense medication. 3. A message is sent out to the exposed population to complete their voucher. 4. People arrive at the designated location with their voucher. If someone does not have their voucher, they are directed where they can complete one. 5. Individuals with a completed voucher are directed to the medication dispensing area. 6. The appropriate medication is dispensed based on the voucher. 7. The person exits with their medication. It is extremely important that you confirm with your direct supervisor what medication process to follow in your jurisdiction, as it may be different from what has been presented here. Please go to www.dispenseassist.net for the latest information.